Yeah.
here.
So, does it work for everyone if we just get started? Sorry to interrupt, if it was important, we can wait.
No.
Okay. So this is just our community working session, which we like to do a couple times a year, to just share what we're working on, hear from each of you as to what you've got going on, and see where we can collaborate or what we can do to work together. So, I don't know, I think we all met at least at some point before, so we'll skip any introductions, but we'll start with the school. If you guys want to let us know what you're up to or what's going on.
Absolutely. Yep, absolutely. So a couple of things coming up at the school. We are going out for an operating referendum. So that is going to be on the ballot on November 2nd. There's an ask for an increase of $531 per student, and it'll be indexed with inflation over the course of the 10 years. And so that's probably our biggest active campaign at the moment, I guess. We do have one school board opening as well, and we have one candidate who has filed for that, and that will all be on the ballot as well. Many of you I saw at the open house for our community center, the PAC, and the CTE wing, which was wonderful to see so many people there. So thank you for those of you that were able to stop, because it just was, that's I think a really good show of community support. We had over 1,000 people at an open house with no other purpose but to come and see the space. You know, that was huge. So we were pretty impressed by that. A couple of things that are in the works. We will have an indoor air quality project at the elementary that's moving forward. That's been on the docket for a number of years, and that will be brought up to a healthier space. So we're looking forward to that. In the future, we have a facilities committee meeting that's evaluated a number of projects. There are some outdoor activities and athletic fields and complexes that are part of the discussion. There's going to be some collaboration with the township and city on some of those discussion points, but our priority, we're really looking to bring our activities up to the complexes and the facilities that are used by our students and our sporting events and things like that are kind of our top priorities. So we're really working to bring those up to par as well. Beyond that, we opened the school year with about 898 students. So we're working on, we'll have a projection at our October board meeting with kind of our, October 1st is really the child count day for our schools, and so we'll see where that's at and what our budget implications are around that. Are there any questions that you have for the school about our current events and happenings?
How are you doing COVID-wise?
So COVID-wise, we actually have been, so our student numbers are really solid. We've had a really healthy response from families that are keeping kids home when they're sick. We have a COVID meeting, team meeting, and we met just before this one. And over the course of this week, we've had 2 cases this week. Last week we had 4 student cases and 2 staff cases, and just the 2 this week. So our numbers are really low in comparison to where we have been. We are keeping a close eye on our county rates, because our county rates are markedly different, and some of our surrounding communities in those school districts are markedly different as well. So we're keeping a close eye on how we can respond and make sure that we're being responsive at the right time, using the right layering factors. So those are some of the things that we talked about today. Yes, sir.
Early voting, how's that?
The last couple of days, we've actually had a number of people come in, and so we're making our first rundown to, and I anticipate now we'll have a steady stream. So we
just go to the district office?
I'm sorry, yes. The district office is the place for people to do absentee ballots, and 8 o'clock till 4:30, Monday through Friday. Yep.
Any other questions or comments for the school? Not seeing anyone.
Yeah, I do. So in relation to the budget that the city's going through and what we're projecting the increase going to be. What's your projection for the school this year with the new referendum? How much of an increase are the residents around town looking at this year?
Yeah, so it'll, and then if you go to our website, there is a breakdown. There's some slides that have different house values, and I'll give you just a couple of them. These are pretty little, but I'm gonna do the best I can here. So for and our tax base is different because we're only taxing on the residential. Our agriculture is only on 1 acre, and so, you know, we have a different tax breakdown in the way that it affects our residents. But for a house that is $175,000 market value, the annual increase would be about $167 for that year. Okay, so if you want to go up to a $350,000 house, it's $333 per year.
Is that including with the referendum? Not?
So that would be at the this is the
Okay.
increase. This would be with the referendum, yes.
Okay.
Yep.
Okay.
Yep.
All right, thank you.
You're welcome.
Next on our agenda is the township. Bueller. Beck.
Skip that.
Skip them. We have Centricare here, though. Hey, guys.
Hi.
How are things going for you?
Well, we've been a little on the busy side, as you can imagine, with everything going on with COVID and some other projects that we have. So a couple things I just wanted to update you on. We do have a vaccine mandate going into effect for our employees. It's effective December 15th. Employees have to have their first vaccination done by November 1st. And right now, we're running about 70% employees vaccinated. We have right now a review going on for medical and religious exemptions. Those will be determined by October 15th, and once that process has been completed, then people will be deciding if they don't qualify for the exemptions, and they will have to make a decision if they're going to be vaccinated or placed on personal leave, which we would keep them on leave for up to a year should they choose to get vaccinated. That's a system-wide initiative. It's not just a Painesville initiative. In fact, I think the 9 largest systems in the state are fairly consistent in that approach around vaccine mandate. And if you've seen the letter to the communities from Dr. Holman, we just feel that it's the right thing to do to make sure that we're keeping our patients safe as possible. We've currently started to do the Pfizer booster vaccines for those that are eligible. Patients are being notified through my chart for their eligibility with regard to that. COVID did an interesting thing in healthcare. Now today, for example, I was on a call this morning. There's about 80 positive cases within the Centricare system right now that are hospitalized, either in ICU or in general medical beds. But the other thing that COVID did is a lot of people delayed care and services. And so we're seeing a lot sicker people come in to the hospital systems, and it's really backed up bed availability. We struggle with finding ability to place patients. The state has what's called a C4 line, and that helps place patients that are in need of acute medical care and services that we normally wouldn't provide in a Painesville setting to try to find a bed. Earlier this year, we were pushing people out as far as Fargo for placements, and right now there's, in some situations, we've had to hold people longer than we normally would have in the past, 3 to 4 days until a bed opens up in St. Cloud or in Minneapolis. So we expect that as the COVID numbers continue to come down, that will help with that situation as well. We're seeing about a 35% increase in our emergency room volumes, which is significant for us. And we're currently doing a review process project to determine our best way to address that increased demand that we're seeing and how to provide coverage with our providers and with our nursing staff to meet that need. Very atypical for us to have over 20 patients a day in the emergency room, and we've had as many as 9 and 10 people waiting in line for services. And part of that is just because the whole system is backed up, and they've had, I think, up to 5 and 6 hour waits in St. Cloud for people to be seen in the ER, and that pushes some of that volume out this way because we're close enough. So we're definitely being impacted on a lot of fronts around COVID and just everything that's happened within the healthcare system. The other thing that I want to just talk a little bit about is the status of our building project. And as you know, the city has some oversight responsibility for that when the project is completed, basically to sign off and as a way to acknowledge closure of the amendment to the 2013 affiliation agreement. At this point, our project will be going to the Centricare Finance Committee and Board in December. It was slated to go in September. We got the pricing back, which was about a week before those meetings. The pricing came in about 30% higher than we anticipated. That's not unusual right now with what's happening in construction, but for the school to have their project done when they did, we're just a little bit behind that curve. And so we're working through, do we need to modify the scope of the project? We have certain elements that are outlined as part of the affiliation agreement that have to be met in terms of those, in the terms of that agreement. But we're working through that in. The positive thing is our operations are strong financially, so we do have the debt service capacity to cover where it's at, assuming that Centricare moves forward with the full cost of the project where it is. But so we're anticipating that. They've told us to, at this point, still plan to be in construction in the spring, and that's what our contractors are locked in on at this point. So once they do that final approval, then those contracts will be formalized, and hopefully we'll be in the ground in the spring when we're able to. So it's been an exciting project. It's a lot of work. It's for us, it'll be a new inpatient area, new emergency room, new universal platform, new entrance, and linked to our Stearns facility. And so we're looking forward to hopefully that process continuing. I spoke with the CFO for Centricare today. He remains to be very supportive of the project, so I'm optimistic that December will be a good meeting for the project and for us to continue moving forward. They just need a little time to digest that 30% increase. So anyway, but any questions that you might have for me?
I got one. You mentioned the emergency room was up 35%. Is that COVID related or not COVID related?
It's a combination. Some of it's COVID population coming in. We haven't had a lot of COVID patients in Painesville. When I was on the call this morning, Brainerd right now has 22 in their hospital. Alexandria had 17. They had 7 up in Sauk Center. I think there were 3 in Melrose. Wilmer, I don't remember what their number was. We haven't had any for quite a while. It's been 1 and 2 when we've had them come in. And so more what we're seeing, I think, is delay of care. And the other thing that we get hit with this time of year is the seasonal. We've had a lot of volume increase, due to lake activity and fish hooks and people skiing in the docks and doing things like that happen in the summertime. So
that's higher than usual?
Yeah, about 35% higher than our normal.
People are getting fish hooks caught?
I don't know.
Well, if St. Cloud is full, then they can.
Yeah. And now it's, the kids are back in school, it's the sporting injuries, it's, those kinds of things are seeing those. And we didn't have a lot of that last year with things being scaled back. So anyway, Steve can address, that probably better than I can. They're the people that are hauling them out, so, and hauling them in. So I don't know if you have any other questions for me, but we're just very busy, and we're hoping that our staff will follow through with the vaccination. We don't have a lot of turnover because of that, but it is an initiative that we're committed to as an organization.
You said you have about a 70% current vax rate for your staff?
Currently.
I think some of the numbers I've seen in other systems is that the provider number is significantly higher than...
Our physicians within Centric, I believe, are 97%, and the APPs are 95 or 96. So those individuals are much higher. Our employees generally reflect the general population, which is running about 70%.
And then you said there are about 80 COVID patients hospitalized, ICU, regular beds, things
Within the Centric Care system.
Right. Do you know how many of those 80 are vaccinated or are not vaccinated?
I haven't seen data this week. Last week I saw it, and I think it was around 84-85% that are not vaccinated. So significantly impacted by that. The other cases are breakthrough cases and people with underlying health conditions.
And has it been Centricare's experience that 15% who are vaccinated generally don't require the level of care that the unvaccinated do when they are hospitalized?
I believe that to be the case. Steve, I don't know if you've heard about that.
I guess
That's definitely what I'm hearing.
Yeah, that's what I've seen, the severity and the length of time in the facility once you do, if you get COVID, that it's less severe.
Okay. All right. I have a couple of other questions, but I'll wait for Steve, and then I think you're a rather better person to answer it, so.
Okay.
Any other questions, Brandon? All right.
All right. Well, just to kind of kick off what Brandon has, said about numbers being increased. Our numbers throughout our department, and maybe I'll explain a change that's been made within Centricare EMS. You'll see the local trucks, and they all look alike, of course, but we've, over the last 2 years, and in the first of this year, we'll complete our second year of our department of Centricare EMS being merged with all Centricare trucks. We have EMS, Emergency Medical Services, in several sites that Centricare has. Those sites are Monticello, which covers the Big Lake, Becker area. We have the Painesville site. We have Long Prairie. We have Benson. We have Wilmer, and we have Redwood Falls. So we cover kind of a large area. And the reason that, one of the huge reasons that we kind of branched into merging into one department is to kind of consolidate all of our efforts. So we went from a local station here in Painesville having 2 to 3 trucks for our service area mainly, to now having a department that has 20 trucks, 150 employees, and 4 managers like myself, and 6 response vehicles that we can get to the scenes quicker than the actual transport truck. So with those larger numbers that Brandon talked about throughout the hospital settings, we're experiencing larger numbers, about a 20 to 30% increase in most months over the last year and a half to 2 years. So, those severities of types of calls have, I think, gotten more severe because, as you would know, that you're not going into the hospital for every little thing, you're waiting, and more people isolating at home and calling 911 when the need is probably a little bit more extreme than what it used to be. So that is something that we are seeing kind of overall, not just in this area, but kind of throughout. So that's been kind of the biggest change for EMS here locally. It's just that we've kind of joined forces, so to speak, throughout the whole Centricare system and brought all of our teams into one department. And so it's proven to be money saving, more economical. We can buy the things we need more as a group versus just one department at a local level. So one of the other things that we do here locally for our department is we do have an education program. So what that really means is that we do teach the EMR level of providers, so your local fire departments and some of the PDs that are first responders for us. We do teach that here locally. It's the group here in Painesville that has kind of taken that on and teaches that. And it started off probably about 4 or 5 years ago that we started doing that just for the need for local city fire departments wanting that education. It started off with one department, and now we teach nine fire departments, and that's just fire departments, and we reach out to all those communities if police departments want to have that education too. So COVID, I know that's usually a question, how has COVID, affected, our department, and you can only imagine it's been stressful. The added stress of going into those environments day after day after day and wearing the protective PPE that they need to. So it's, we're trying to hold the crews together, the employees together, so that's, but you'll see that throughout healthcare. I don't think it's specific to EMS in any means. I think it's healthcare in general that is feeling that stress. So it's high on our priority list to address that and to kind of be out on the lookout for that and help employees to do what they do every day. So other than that, just trying to, the volumes are there, and we're trying to do the best for all the communities that we serve. We have central care in areas that we don't have the ambulance service. That's not our area. So we also we feel we have a responsibility to those facilities. The St. Cloud Hospital, hospitals like maybe a Sauk Center or Melrose, so we try to do what we can also for those community hospitals that are central care, but have a different ambulance service there. So there's a lot of different situations out there that we also take notice of and do what we can for this whole central Minnesota area. So.
The question I had, and it goes back to what Brandon was talking about, having to ship patients to Fargo and other parts of the state, is when we have to do a transport like that and you have to get a backup rig in town, how long does that take, and how long are we essentially sitting here without a local ambulance sometimes because of, frankly, people who can't get vaccinated and take this seriously?
Sure. It's a great question. And that's another benefit of the system that we have right now is that if that is depending on the severity of that transport, if it's a patient that needs to be moved very, very quickly, we call that a code 3 transport, where it's a lights and sirens type move. We will take the closest resource to move that patient. If we have time, which the majority of the time we have resources or time to bring resources within range before we deploy that truck on that transfer. So if we have Brendan has a patient that needs to get to Fargo, for instance, as an example, we'll get the call, we'll throw it in our queue, and our dispatch center will immediately see how many trucks we have in the queue in Painesville. So most days we have 2 trucks assigned to Painesville. All right, so unless we're out on a call, today, for example, we had both trucks out on a call. One on a transfer, one on a 911 call here locally, where we had to shift the truck from Wilmera to this area to cover the PSA. So in most cases, we have the ability to move a truck into our area. The Wilmera trucks, the Redwood Falls trucks, Highway 23, most of them have to use that to get to St. Cloud. So we have a lot of moving trucks. So typically we can move a truck into our sector and cover that area while we do a transport out. So constant move, anywhere from, depending the time of the day, anywhere from 8 to 12 or 13 trucks on at one time in that area. And always one manager like myself that's on call, looking at the screens, looking at pulse, and we can see our trucks moving to make those decisions where hospital needs to move somebody. Do we have a truck close to cover that PSA? So to answer your question, is we really try to hold it and not for that to be the case hardly at all. And if we have to, we have mutual aid agreements with the neighboring towns to cover that. But that is a very high priority of ours to cover.
Yeah, I just see the trucks going in and out all day long in my backyard. It's a constant shuffle, way more than it's been since I moved in.
And the one thing to kind of acknowledge and remember is that if you think about those communities that I've said where we have EMS and their essential care trucks, Painesville is kind of the hub. You know, and that, so you will see a lot of trucks float through this area, and they might be passing through to stage here for a short while. They might be hitting our Painesville Hospital for a transport. They might even be coming through just to pick up some supplies because they've been out on 2-3 calls, and we have the supplies they need here in Painesville. So they swoop in and they grab what they need, from medications to the supplies in the truck. They're busy, and then they're off. So yeah. Where you live, you probably see that truck drive by several times a day.
Oh, yeah.
Yeah.
But are you saying then that you need a bigger garage and a longer lease agreement?
Don't give me any ideas.
If you're offering.
Any other questions for Steve?
I did go in and just pulled out the October 4th data, and statewide there's 865 COVID cases in the state and that are hospitalized, and there are 224 in the metro, 113 outstate that are in ICUs. So 337 of those 865 are heavy care patients. About half metro, half outstate, so we're disproportionately getting our share of COVID.
Yeah. All right. Thanks, everyone. I'll take the lead on what we've got going on. Jennifer told me not to use the word quiet, so I won't say that it's been that way.
You said it anyway.
I did not.
You just said
no. I didn't. Nope, not in that context. What we've got going on, Lewis Industries recently broke ground on their expansion project out there in the industrial park. So they're continuing to use the land that they have. Our EDAP board is looking at expanding our industrial park and maybe purchasing some land that we can get some more manufacturing into town. We'll see where that goes, if we can look at where we've been planning or if we have to look elsewhere for land. We did talk previously about the potential for developing a new mobile home park and relocating those residents that are there now. We had a nice long meeting with the residents this spring, and they just decided, they informed us that there was just no way they could make that feasible. So the council decided that we're not going to uproot anyone from their home and make anyone homeless. So that project is not moving forward. It was essentially done on arrival to the residents, and they're the ones whose voice mattered the most. So we have a new police and fire committee, which was going to be more relevant to the township because I need somebody from the township to serve on that committee, but they're not here, so they'll just get a nice phone call from me later. Otherwise, we have, thanks to our Park and Tree Committee, and Megan can talk about this a little bit more if I miss something, but a new dog park in town. So that was nice. We took a look at the resources that we had, realized that for a few $1,000s we were able to convert an existing area of land into a dog park that the public can use. And we got the gates up and running. I don't know if we have the other amenities for it yet, but they'll be coming soon if they're not out there now. So that's over by the community park and the BMX trail. we're looking at a budget that's higher than we're accustomed to, but it gets us balanced with the needs of the city, and we'll see where that goes. I don't know if anybody has any questions for us. Thank you for being
Can I add to
here.
that?
Yeah, Tarek's got stuff.
Well, I just want to say that also a priority for us is to try to find a way to increase housing in the city. So several things that we're trying to work on and work with other developers or even businesses to see what can be done about that. So that's going to be a priority for us in the coming year.
Aren't we looking at money for a trail or safe trail to school or something like that?
Yep, Paul.
Yep.
Paul knows about that.
Well, this is a different trail, kind of.
And the safe routes to schools,
Yeah.
my understanding is that that's being pushed back a little bit now.
Well, yeah, we spoke with Janelle about it, you know, and I think the state of Minnesota is a bit behind, but it's still going as, you know, it's still going as it should, it's just behind schedule.
So it's not that we're necessarily pushing it back, but
No.
higher ups maybe.
Yeah, there's a process that's established through the state of Minnesota, and so you have to have all the players, and we've got all the players, and then you follow their process, and so then they have to come out and, so we've got the steps in place, now we have to wait for their next steps. Yep.
I think we're hoping to connect a more isolated neighborhood that doesn't currently have great access by walking or biking to schools, so.
Yeah.
So on the Joint Powers Trail Board, we're looking at moving a trail connecting the Glacier Lakes Trail into town. And somewhere along the way, it has to cross the Crow River. That's our big hiccup right now is, where's that gonna come?
The new daycare center, are we looking first of the year or?
Yeah, you know, the Shopco building is now going to be a child care facility. Met with the business owner out there a couple weeks ago, actually, and, you know, things are behind schedule. I think the permitting from the state of Minnesota has also been taking longer than they thought. Of course, when they initially acquired the building, I would say early summertime or late springtime, their goal was to be open by September 1st. And of course, that didn't happen. My last conversation with them, they're expecting to be open sometime the first of the year.
Any other comments? All right. Then we like to do these about every 6 months, so that puts us in about April of next year, if that works for everyone. If anyone knows that they've got any trips planned.
I was going to make one more comment
Yeah.
on the city. A lot of businesses have changed hands. Dittman is now some frozen meat
Better Fed
company.
Beef Company.
Better Fed Beef, they
Yep.
got a great website, they're popular.
Tentatively, something could be going in the Riley Flanders building.
Yep.
To my knowledge, the only building in town that's for sale is the theater. Everything else is actually sold, somebody owns, they're paying taxes.
Let's hope it gets acquired soon.
Indeed.
Heard rumors of
And
interest.
for when you drive through a lot of cities, that's not the case.
Rumors of interest.
Yeah. I think that because the downtown is not retail, it's more service oriented, people think that it's worse off than it is, but compared to other cities with our population, our downtown is actually doing pretty well, so.
Nothing worse than empty buildings deteriorating, I mean,
That's true.
so.
If you ever bring your kids to the dentist at like noon on a weekday, can't find a parking spot, that's for sure.
Good thing he bought a new building.
Yeah.
He moving.
Do we want to look at picking a date now, or would it work better for Jennifer to just send out a proposed date? Okay, we'll just send out a date.
That works.
I thought so too, but, you know,
Is Thursday a good evening for most people? I think it is.
Should be fine.
If we can get the township a little more involved.
I know in the past, we've just scheduled him to work on some of these meeting nights, but we'll reach out to them. Thank you, everyone. Appreciate it.
Thanks for having us.
Thank you.
So with Brandon,